Hi there, students. I'm Crisel Merducanes, a clinical instructor teaching fundamentals of nursing practice. If you have any question or if you want to clarify some gray areas with regards to our topic today, please comment down below. I would be glad to read those comments. Also, if you want to suggest any topic or content for our next videos, please also write them below. And if you find this YouTube channel helpful, please click the like and subscribe button to keep you updated for new video uploads. So for today, our topic is about monitoring and measuring intake and output. It is also known as your MIO. So first, let's discuss about intake. What is intake? It includes all the food and fluids that are that are liquid at room temperature, such as your ice cream, your gelatin, etc. We also have your parenteral fluids and any other fluids taken into the body. On the other hand, your output means it includes urine, bile, vomitus, diarrhea, perspiration, and drainage from suctioning devices, blood loss, and other fluids that come out of the body. So anything that comes out of the body is your output, and it is very important that you should measure them. Okay, measure your output. We also have indicators. What are the indicators? So we measure the urine output. We measure the intake and output of patients who are ill that cause alteration in their fluid balance. Okay? It is usually advised when a fluid imbalance exists or the client is at risk. For example, if your client has a renal problem or a renal disease, so it is very important to monitor their intake as well as their output. Since patients who are who have renal problems, they have problems in eliminating excess fluids in the body. So as a result, body fluids that are excessive are being retained inside the body. We also have objective. Objective, what is the purpose, what is the aim of monitoring the intake and output of our patient? It is to accurately calculate and monitor intake and output to assess hydration and fluid retention. So it's more of the assessment function. It has an assessment function to assess the hydration as well as the fluid retention of the patient. So we have here considerations. So compare the weight of the clean product with the soiled product. Okay. For example, your patient wears diaper. Okay. So make sure before putting on the diaper to your patient, you have to weigh the unused diaper. Because later on, you will subtract the weight of your soiled diaper from your unused diaper, and that will serve as your urine output. So that is very important to consider. Okay, we also have to notify the doctor if early urine output is less than 30 ml per hour in adult, or if client refuses any more fluid intake, infusion, and drainage device. Okay, so remember that the normal urine output rate for an adult is 30 ml per hour. Okay, at least 30 ml per hour. So if it is less than 30 ml per hour, you have to inform your doctor because it is abnormal. Okay? Watch out for fluid restriction order. Okay? So for example, your patient has a renal problem. Usually, patients who have renal problems have fluid restrictions. So the doctor orders only 1 liter of intake, of fluid intake per day. So as a nurse, you have to be cautious that the patient should maintain 1 liter of water consumption per day. Okay, you have to watch the patient's intake. Okay, use gloves when handling body fluids. So you have to use gloves when draining a Foley catheter, or if you drain some other drainage devices that your patient might have. Okay, you use gloves. Okay. Contraindication. What are the contraindications? Okay, in monitoring your intake and output of your patient. So client has consistent, adequate intake and output. Okay. So meaning, if you think that your patient has maintained a consistent and adequate intake and output, you may lesser or you may lessen the frequency of monitoring the intake and output. So for example, before, you're monitoring the intake and output every hour, so you can have it now monitored every 4 hours. Okay, if the patient has achieved a normal daily intake and output for adults 2,500 to 3,000 ml. Okay, so if your patient has achieved this goal, so you have to lessen the frequency of monitoring the patient. So client's teaching. So you have to inform the client or family member in room assisting that all intake and output must be measured and offer guidelines as necessary, such as notifying the nurse at each voiding. Okay, so remember, you only uh, you have other patients as well, so you could not really monitor the patient uh, from time to time. Okay, so all you need to do is to ask assistance from the folks or from the other family member to monitor the intake and output of your patient. And your responsibility for that is you have to orient the family member or the folks of the patient that they need to record, okay, each urine output or each intake of fluids. Okay, so you need to provide a recording material or recording sheet for them. Okay, in that way you will be able to accurately measure the intake and output of your patient. Alert the doctor if there is a rapid weight more than 2 pounds per day. Okay, that's abnormal. New onset of severe pulmonary difficulty. So for example, respiratory rate more than 30 breaths per minute. Okay, remember that the normal respiratory rate is from 12 to 20 breaths per minute. So more than 30 breaths per minute, meaning your patient is experiencing respiratory distress, and it should be reported to your physician. Crackles and bronchial breath sounds. Okay, this could indicate fluid volume overload or excess fluid in the body. Change in urine output. Your urine output is less than 30 ml per hour for 2 or more consecutive hours. Okay, so as what I have mentioned, the normal urine output of an adult is 30 ml per hour. So if it is less than 30 ml per hour for 2 or more consecutive hours, that is an abnormal findings. Okay, you need to alert or you need to notify your doctor. And of course, change in mental status. If your patient has experienced a change in the mental status, you have to alert the doctor. Okay, So we have here salient points or important points that we need to consider when we measure and monitor the intake and output of our patient. So daily weight measurement is an effective means of evaluating hydration status and weigh the client at the same time every day using the same scale and the same type and amount of bed clothing. So this purpose is to make sure the accuracy of the data that you will be collecting, okay, during the procedure. So again, you weigh the patient on the same time of the day using the same scale and the same type and amount of bed clothing. So conversion. So very important that nurses should know how to convert uh, common household measurement. Okay. So for 1 liter, it is equivalent to 1000 ml. Okay. So remember, in the hospital or in any healthcare institution, we are usually using the ml uh, equivalent. Okay, the ml equivalent. Okay, so when we say ml, it is the same as your cc or your cubic centimeters. Okay, in the hospital you might see ml or cc, so it's the same thing, it's the same equivalent. Okay, so for example, if you have 1 liter, it is equivalent to 1000 ml. If you have 1 teaspoon or tsp, that is equivalent to 5 ml or 5 cc. 1 tablespoon TBSP, that is equivalent to 15 ml or 15 cc. 1 ounce or OZ, it's 30 ml, okay, or 30 cc. 1 pint PT, 500 ml. 1 quart QT is equivalent to 1000 ml or 1000 cc. Okay, 2.2 pounds is equivalent to 1 kilogram. 1 kilogram is equivalent to 1000 gram. 1 gram is equivalent to 1 ml. And 1 cup is equivalent to 240 ml. Okay, or 140 cc. So these are the most common household measurements that you could see in the hospital. Okay, so might as well you need to memorize and get familiarized with these equivalents. Okay, so again, you need to convert them to ml or cc. Okay, milliliters or to cc. Okay, so I think we're done with our discussion with the intake and output measurement. So now let's proceed to St. Paul's Hospital Iloilo, the 24-hour intake and output monitoring sheet. Okay, so each institution, each healthcare institution has its own way or has its own guidelines when it comes to recording your 24 hours intake and output. But for our own uh, but for our own practice, we use the the format of St. Paul's Hospital Iloilo. So we have here, so we have the name, we have the room or the ward number, the doctor, and the case number. Okay, so these are pseudonames. Okay, this doesn't belong to any patient in the hospital. This was made for the purpose of this presentation. Okay, so we have here the intake and the output. Okay, so as you can see, we have the date as the heading, we have the time, we have their oral, IV, others, intake, and urine, emesis, drainage, stool, and output. Okay, so as you can see, we are using two different marking inks. Okay, so we have the black and the red ink. Okay, so first let's please focus on the date. So we have, for example, January 4, 2019. That's the date. Then the time there is A, and it is written in black ink. Okay, A means the nurse's duty is from 7 a.m. until 7 p.m. Okay, so if the nurse if the nurse's shift is from 7 a.m. until 6:59, to be exact, 6:59 p.m., he or she will need to use the black pen, okay, and write letter A, because it is understandable that if the nurse writes big letter A or capital letter A, that means his or her duty is from 7 a.m. until 6:59 p.m. Okay, so it's written in black ink. So you write A. Then oral, you have to compute all the oral intake of your patients during that time. Okay, you have to compute the total amount. And also the IV, intravenous. You have to compute the total IV infused to your patient. Others means if, for example, if the patient has antibiotics, okay, you have infused antibiotics, intravenous antibiotics to your patient, so you have to write there the amount. Okay, you have to specify the amount there in the others. If there's none, you may leave it blank. Okay, then after that we have the intake. Okay, intake means you have to total the oral, the IV, and the others. Okay, you have to total that one and you have to write it under the intake column. Okay, now we're done with the intake. We'll go to your output. Okay, so in your output we have urine. Okay, you have to compute the total urine for 12 hours of your patient and write it down. Okay, then emesis means the vomitus. If the patient had vomited during your shift, you have to approximate, or you have to know the amount of the vomitus of the patient and you have to write it down. Okay, drainage. When we say drainage, for example, we have a Jackson-Pratt drainage and you have drained an amount there, drainage amount. You have to put the total amount of your drainage for 12 hours there. Okay, for example, of your drainage, we have your JP drain, hemovac, we have your what else? We have your the drainage if you have a cholecystectomy. Okay, cholecystectomy, there is a drainage there, so you could write. So anything that that your patient has, you could put it there as a drainage. Okay, drainage system. Stool. Okay, so in your stool you have to count the frequency. For example, in this in this presentation, the nurse defecated 2 times. Okay, so I write there 2 with 2 letter T. Okay, the 2 letter T. Then I put 2 dot above. Okay, that indicates the stool. Okay, that means the patient had defecated twice during your 12-hour shift. Okay, then after that you have to total the urine, the emesis, the drainage in your output. Okay, so for example, so in any for example, if your patient has diarrhea or loose bowel movement, so for that matter, it is very important that you need to monitor the of amount of stool that that had been defecated by your patient. So in that sense, you will have to put the exact amount per ml of how much did the patient defecate during your shift. So instead of using the Roman numerals there, you have to write the actual amount, or the approximate amount of your stool there. Okay, so for normal persons that do not have problems in terms of their bowel elimination, so you could write there the frequency using the small Roman numerals. Okay, so we're done with the morning shift or the AM shift. So let's proceed with your PM shift. So the nurse endorses the patient to the incoming nurse. So the incoming nurse will be the one to fill up the lower portion. So here we have, here we need to write again the date and the time. Okay, so the time there is N, capital letter N, which means it's a night shift. Okay, so night shift begins from 7 p.m. until 6:59 a.m. the following day. Okay, that's a 12-hour shift. So as you notice, the nurse used red ink, okay, to distinguish that it is a night shift. Okay, so we write it in green ink. So for oral, the same thing, we compute the 12-hour shift, total oral intake, IV, others, and we have to total it in the intake column. The same goes with your output. Okay. However, the night shift will be the one to total the 24 hours intake. Okay. So in doing that, we have here intake. Okay, we have to total the intake from the AM shift, the morning shift, and the night shift. So in this example, we have a total of 1,200 intake. Okay. For your output, it's 400 plus 400. So it's 800. Okay. So obviously, we have an intake of 1,200 and we have an output of 800. Okay. Then we have to determine the difference between the two. So we have to subtract 1,200 to 800. So that amount is, the difference is 400. Okay, that's your 24-hour difference. Okay, so now let's identify if the patient has retention or excess. Okay, so in the hospital, we use these terms, retention and excess, to determine the fluid status of our patient for 24 hours. So you have to write there 24 hours. Then in this recording, we write R. Okay, that means retention. Why retention? Okay, so in the hospital, we consider the patient has retention if the intake output is greater than the if the intake if the intake is greater than the output, we consider that as a retention. Okay, so we write 24 hours retention equals 400. Then we have to box it. Okay, enclose it in the box. Okay, so we have 24 hours retention equals 400. Then enclose it in a box. Okay, so in the event that the output is greater as compared to your intake, so that is an excess. So you have to write 24 hours excess, or E, 24 hours E equals 400. Then enclose that one in a box. Okay, so that's how you make your 24 hours intake and output, basing on the guidelines and policies of St. Paul's Hospital, Iloilo. Okay, so do you understand? Okay, so you will have time later that you will be the one to have to record this intake and output. Okay, so I have prepared exercises and activities for you to accomplish. It is the application of the concept that we have discussed earlier. So please stay posted with regards to this. So I think that is the end of my discussion. So I hope you learned something today.